This year alone, the American Cancer Society estimates more than 22,000 women will be diagnosed with ovarian cancer here in Pittsburgh. Local doctors are working on new treatments.
Yeah, and in this morning's Eye on Health, Dr. Thomas Krivak and cancer survivor Charlotte Duzicky are here to talk about those methods. And this is so important because really detection is the first step, and it's hard in this case with ovarian cancer, right?
Detection is the first step, and it is hard because so many symptoms mimic ovarian cancer, and it's what they call it like a silent, whisper type of symptoms. And that's why I think it's important to see your doctor, pay attention to those symptoms, and if they persist, further up testing is necessary. But at this point, you're absolutely correct. There is no screening test for ovarian cancer like there is for breast cancer, colon cancer, and cervix cancer.
Okay, and now Charlotte, you were diagnosed with ovarian cancer and you're in remission now. So what were some of the symptoms that you noticed at first?
So I did not notice a lot of symptoms prior. Looking back in hindsight, I can tell you that I did definitely have some weight gain. There were things I thought were just irritable bowel syndrome, the night sweats, but I was also menopausal at the time, so I was confused, not thinking that it had anything to do with ovarian cancer, but more with menopause.
And in fact, at one point you thought you had appendicitis.
I did, yes, because I started with the pain inside my right hip, and a couple days later, then I had an excruciating pain across my abdomen, and that's what made me go to the emergency room.
And so when you found out that that was the case, that you had ovarian cancer, what was that like? I can imagine that was devastating.
It was, but I had a great support system at home with my sons and my coworkers and my church family. I more or less turned it over to God and told them to tell me where to be, and I would be there, and I wasn't going to worry about the research and the other things. So I was fortunate to have Dr. Krivak.
Yeah, absolutely. And we're so glad that you can say remission now.
Yes.
I agree.
Yeah. So, doctor, as far as when you hear the words ovarian cancer, people need to know that is not a death sentence. There are new ways to treat it, and even though it's a very heavy thing to get that diagnosis, it's not without hope.
Correct. I think, 15, 20 years ago, it was very devastating. Now, in the last 5 to 10 years, we've had a lot of treatments. We've gotten better with our surgical skills. Surgical removal of the tumor is very important. Treating with chemotherapy inside the abdomen at times is very important. And then most of the positive clinical trials showing a really positive outcome have shown that using maintenance chemotherapy or maintenance treatment, which is, think about, we treat the cancer really aggressively with surgery and then aggressive chemotherapy, and then we will place patients on low-dose treatments. And those low-dose treatments we think will help prevent the cancer from coming back, as well as we hope will hopefully cure more patients. And so, Charlotte is courageous. She's done great throughout the whole treatment. Again, mind, body, soul, I think is very, very important. She's approached it all that way. And then really, one of the most fascinating things is that we had a clinical trial that, you received standard treatment up front, which was surgery and chemotherapy. And then Charlotte is receiving an oral drug called niraparib, or a PARP inhibitor, as well as she received Avastin for a year. So a combination of 2 drugs, your hair can grow back, you don't have the profound side effects from some chemotherapies are side effects to this, and then you're staying on an oral drug for an extra 2 years. So you take your initial treatment, which is about 6 months, and then after that you're using low-dose treatments for about 3 years, again, to hopefully prevent the cancer from coming back.
It's amazing how treatment has evolved. But if you're a woman and you're sitting at home, what are some of the signs and symptoms that you can look for to make sure that this is not happening to you?
I think if you have pain, the way Charlotte is saying she had pain and went and had to go get follow-up, anytime that there's abnormal vaginal bleeding, postmenopausal bleeding, you'd want to get that evaluated as well. I think those are the biggest signs. When you start to have abdominal bloating, you eat a couple bites, you feel kind of sick to your tummy. Those are things that need to be looked at, not just for ovarian cancer, but other reasons. But to me, those are some of the more common symptoms that we see. But not everybody that has those will actually have ovarian cancer.
And we also want to let everyone know there's an event coming up that actually supports survivors and supports research. Tell us about that.
So the NOCC, which is National Ovarian Cancer Coalition, they have a chapter here in Pittsburgh, which is a very active chapter. They're going to have a walk not this Sunday, but I think it's September 15th in North Park. And to me, I think it's a great it's a great event because I think it gets patients involved with the physicians go, our nurses go, they can see other family members. I think when you have the diagnosis of cancer, at times you feel isolated because ovarian cancer is 22,000 patients per year, and if you look at that, that's about 10% of what breast cancer is. So it's not as common. So I think it's nice to get patients in these groups to be able to provide support for each other for that. And then again, I think Stand Up to Cancer is having an event with the Pittsburgh Pirates this Saturday where we actually have a patient of ours of ovarian cancer throwing out the first pitch. So it goes to show you how great Charlotte looks. I mean, to me, she doesn't look like she has
Not
cancer.
at all.
She's in remission. She looks great. And again, this weekend we're going to have somebody throwing out the first pitch. So just like you said, there's great hope for patients with ovarian cancer. It's just getting to the right physicians, getting to the right treatments, and making sure everything gets done aggressively.
Such good news.
Yeah, and what a great message that you two have brought, and especially you being here, Charlotte, because you will inspire other women. So that's fantastic.
Thank you.
Yeah. All right, well, keep watching here for our Eye on Health series on PTL. It's every other Wednesday, sponsored by Highmark Blue Cross Blue Shield, together with Allegheny Health Network for your health.